This will be the final hearing during my 6 years as chairman of the committee. Last week at our hearing, I thanked Senator Murray and her staff for their friendship and diligence and cooperation, without which our committee would not have accomplished all the things we've been able to accomplish. This week, I'd like also to thank the most senior Republican member, Senator Mike Enzi, and all other 20 senators on the committee, both Democrat and Republican. Senator Ted Kennedy used to say that our committee had the broadest jurisdiction in the Senate. You only have to look around the room at a hearing and see that we also have the broadest range of views in the Senate and some of the ablest advocates of those views. But thanks to our committee members and to Senator Murray, most of our hearings have been bipartisan, which means we've agreed on a broad range of witnesses to present points of view. And while the questioning and the statements of senators has been probing, there's always been a high level of courtesy, both to the witnesses and to the other senators, which I'm grateful for. I believe this ability to work together during such a rancorous time is a big contributor to why we've been able to accomplish so much. The work of this committee represents my view that as far as the United States Senate goes, it's hard to get here, it's hard to stay here, and while you're here, you might as well try to accomplish something good for the country, which this committee has done on numerous occasions. The Trump administration's program to develop and deploy a vaccine against COVID-19 is on track to be an unprecedented sprint to success. The program, called Operation Warp Speed, will save lives without cutting corners on safety and efficiency. The COVID-19 vaccine development process is likely to produce its first tens of millions of doses within 1 year. The United States has never produced a vaccine that rapidly. When I was a child, I saw classmates in iron lungs. We waited 10 years for a polio vaccine to be, so we wouldn't be afraid of polio. Many existing vaccines for other diseases that children take routinely before they go to school, like chickenpox and the measles, have taken 10 years to develop. The secret to the success of this effort is that the government, in partnership with private industry, is for the first time developing and manufacturing vaccines in parallel. Now, what that means is that Operation Warp Speed is manufacturing tens of millions of doses of the 6 vaccine candidates. At the same time, the clinical trials are ongoing, and the Food and Drug Administration works to determine whether those vaccines are safe and effective. If the FDA does not approve the vaccine, it will not be distributed. So the risk is taxpayer money, not the safety and efficacy of the vaccine. The administration had set a stretch goal that once seemed impossible but now seems likely. The administration hopes to have as many as 300 million doses of vaccines available to be deployed by mid-2021, according to an August 26 article by Operation Warp Speed Program's principal advisor, Dr. Moncef Slaoui, and vaccine expert, Dr. Matthew Hepburn, that was published in the New England Journal of Medicine. The authors also wrote, no scientific enterprise could guarantee success by January 2021, but the strategic decisions and choices we've made, the support the government has provided, the accomplishments to date, make us optimistic that we will succeed in this unprecedented endeavor. Mr. Paul Mango with the Department of Health and Human Services said recently that in a meeting that if all goes well, it's possible that up to 700 million doses will have been manufactured by April of next year, 2021. The Department of Health and Human Services, Department of Defense, private sector, public health, and medical professionals also are working together to lay the groundwork for deciding who gets the first doses, such as healthcare workers and certain high-risk populations, and how to get those doses to those individuals. The Centers for Disease Control has asked states to submit plans by the middle of October of this year, next month, to begin distribution. Now, there's been a lot of back and forth over exactly which date the first vaccine doses, which remember are already being manufactured and made ready for distribution, When will they be available for distribution to the public? The answer, of course, is that the only people who know when a vaccine will be ready are the scientists at FDA, who will review the science and the clinical trial data and determine whether the vaccine is safe and it works. Even Dr. Stephen Hahn, the commissioner of the FDA, who is testifying today, does not know when that date will be, because the FDA will not approve a vaccine until three things happen. One, independent experts overseeing clinical trials determine there's enough data available to the FDA to make a decision. Two, after demonstrating safety and efficacy based on clinical trials, the vaccine manufacturer submits an application to the FDA. And then three, FDA experts conduct their review and make the final determination the vaccine is safe and that it works. Now, as to treatments, the second unprecedented story of the United States response to COVID-19 is the development of treatments. There are 5 products authorized for emergency use today to help treat and manage COVID-19 symptoms, including remdesivir, certain steroids, blood thinner, convalescent plasma. Operation Warp Speed officials are optimistic, they say, that more treatments will be identified or developed and in clinical trials this fall, with potential for approval or authorization by the end of the year. The most promising appear to be monoclonal antibody cocktails, which have been used to prevent and treat other diseases like Ebola. 3 companies are in clinical trials of antibody cocktails. Knowing there is some medicine that will help treat COVID-19 should greatly relieve the anxiety of Americans who want to go back to college, back to school, back to childcare, back to work, and out to eat. And third, a third success story is the explosion of fast, cheap, reliable diagnostic tests. After initial missteps, our country lost several crucial weeks in distributing the diagnostic tests that would help to identify and isolate those who contracted the virus. But since then, an unprecedented effort of public and private research has created capacity this month for administering more than 90 million tests, about half of them rapid tests, according to Admiral Jiwa, who's here today. Abbott Laboratories says that it's on track to produce 50 million of those tests, 50 million of its tests a month by October, which can produce a result in 15 minutes and cost $5 a test. The government has purchased 150 million of Abbott's tests to help expand testing in places like schools and nursing homes, and I'm sure we'll hear something about how that will be distributed today. Congress funded the so-called Shark Tank, or Rapid Acceleration of Diagnostics Initiative at NIH, with the objective of developing and deploying tens of millions of new rapid diagnostic tests. Dr. Francis Collins, director of NIH, has reported that combined, these new technologies have the potential to add at least 60 million new tests a month by December. Dr. Collins has told me, quote, "This is not the end of the story. There are lots of additional technologies coming through the pipeline, many of which are rapid, inexpensive, point-of-care, and home-based tests," unquote. Until vaccines and treatments are widely distributed, this explosion of many cheap, reliable, rapid diagnostic tests is our best weapon to build confidence among the American people that it's safe to go back to school, back to work, and out to eat. There should be plenty of tests. In fact, there are now to do surveillance testing of those without symptoms in certain settings like colleges and child care centers. It's important to give credit to this Congress and this President for funding this unprecedented effort to develop and manufacture vaccines before they're all approved, knowing full well that one or all of them might fail with a considerable loss of money. Since March, Congress has appropriated more than $47 billion for tests, treatments, and vaccines, a large amount that pales in size, though, to the $3 trillion spent to try to ease the pain by shutting down the economy. And it's important to give credit to the previous presidents and previous Congresses for the bipartisan work they've done over the last 20 years to make possible the remarkable successes I just described earlier. Dr. Slaoui, for example, told me that the government today could not be manufacturing 4 of the vaccines that are currently being developed if Congress had not provided the Department of Health and Human Services with funding to make awards in 2012, 8 years ago, to build 3 manufacturing plants that would be on standby for the next epidemic. The decision to look ahead then to the next pandemic, and some on this committee, Senator Burr specifically, had a role in that. Dr. Slaoui said that was visionary. On March 1, the New York Times reported that the United States is among the countries best prepared to prevent or manage such an epidemic, focused on COVID. Why would they say that on March the 1st? Well, let's look at the NIH. For 5 consecutive years, this Congress has significantly increased investment in the National Institutes of Health for biomedical research. And NIH's Infectious Clinical Research Consortium, which was established last year, was able rapidly to shift ongoing clinical trials and quickly enroll volunteers for COVID-19 trials and treatments and vaccines. Or look at the FDA. Congress provided FDA with specific authorities beginning in 2004, 16 years ago, to review and issue emergency use authorizations for tests, treatments, and vaccines to respond to public health emergencies. Dr. Hahn has used that authority. FDA has used that authority to authorize 250 tests and 5 treatments as quickly as possible, and also to remove tests and treatments when additional evidence showed they didn't work as well as they should. Or look at BARDA. Congress established the Biomedical Advanced Research and Development Authority in 2006, 14 years ago, to help companies work with FDA to get safe and effective tests, treatments, and vaccines out. BARDA was able to announce awards for potential COVID-19 treatment and vaccine candidates just over 1 month after the vaccine was first reported in China. As I said earlier, 4 of the first 6 vaccines are being manufactured in facilities built in 2012 for this purpose, for a future pandemic. And then there's been federal support over the years for state, local, and hospital preparedness, $21 billion between 2002 and 2017. CDC has used existing programs to help states retrain workforces, expand lab capacity, planning for a future pandemic from pandemics during the last several years. And even with supercomputing, these Congresses, the last few, have increased funding in the Department of Energy so that the United States is first in the world in supercomputing. They're at our national laboratories, and they're being used to help develop treatments and vaccines. So I go through all of that to show that several Congresses and several presidents have done things to help us get ready for this unprecedented sprint towards success in vaccines, treatments, and tests. Now, finally, I'd like for this Congress to be visionary as well. And while we're in the midst of this pandemic, to be ready, help get ready for the next one. Former Senator Frist, the majority leader, testified before this committee that the next pandemic is not a question of if, but when. Jared Diamond, the author of Guns, Germs, and Steel, says the main thing that's different about this germ is the jet plane, that people can travel around the country and around the world and spread it. And so he concludes that the next pandemic could be next year. Congress should take stock now, while our attention is on the current crisis, of what we've learned during COVID-19 and address some of the problems we know we can solve, just like previous Congresses and previous presidents did. Many of the witnesses that have appeared before this committee have agreed we have 3 things to do. 1, sustain onshore manufacturing of tests, treatments, and vaccines. 2, create and sustain state stockpiles of supplies so they'll be available in a public health emergency, and strengthen the strategic national stockpile. We've seen time and time again, attention spans are short. We must act now to stop the cycle of panic, neglect, panic. I look forward to hearing from all of our witnesses today about how the federal government is continuing to respond and to help state respond, how soon we can expect more treatments and a vaccine for COVID-19, and what steps we can take now to prepare for the next pandemic. I will now recognize Senator Murray for her opening statement.